The story begins with the hum of machinery as an endless line of blue scrubs moves along a track. They are uniforms for the heroes of the hospital, yet they look like products on an assembly line, sterile and impersonal. This is the world of Gloria, a nurse whose day is just beginning. She rides the bus, the city lights blurring past, a quiet moment before the storm. Stepping into the hospital, she dons her blue armor, ready for battle. But today, the battle starts before she can even catch her breath. A colleague informs her they have 25 patients on the ward, nearly a full house. To make matters worse, another nurse is sick, leaving them severely understaffed. They are just 2 nurses and 1 first-semester student, Amelie, who looks utterly lost. The chaos begins immediately in room 1. An elderly woman, Frau Kuhn, is disoriented and needs to be cleaned. Gloria and her male colleague, Florian, handle her with practiced gentleness, counting to 3 to help her stand. They navigate her fragility with reassuring words, a stark contrast to the hectic pace outside the room. No sooner is Frau Kuhn settled than the next crisis emerges. A patient, Herloy, is anxiously waiting for his test results. He's been there for 6 days, and no one has told him anything. The diagnosis is grim, colon cancer. But the doctor is stuck in emergency surgery and can't deliver the news. Gloria is left to manage his growing frustration, a messenger with no message to deliver. Meanwhile, the student Amelie is tasked with prepping a young man, her nana, for a CT scan. He's terrified of the nasogastric tube needed for the procedure and is nauseous from the contrast agent. Gloria tries to comfort him, telling him, "You have me," a small promise in a sea of fear, but she's immediately pulled away by another emergency. Her Schneider is in pain, his daughter watching helplessly as he fades away. The daughter confesses a terrible wish, that he could just let go. It's not egoism, Gloria reassures her, but a normal feeling in an impossible situation. The demands pile up. A phone call from a former patient's daughter about a lost pair of glasses. Private patient Severin coldly asks for a painkiller. The family of Frau Belgin, a cancer patient, corners Gloria in the hallway, desperate for an update from the doctor who never seems to come. Everywhere she turns, there's another fire to put out, another person in need. Amelie, the student, makes a mistake, forgetting to restock the cart with glucose. Gloria has to correct her, adding another layer of stress to her already overloaded mind. The pressure is palpable. Gloria finds a new patient, Frau Frey, smoking on a balcony right next to her oxygen tank. She confiscates the cigarettes, earning a string of insults for her trouble. Then, a call comes from the recovery room. A patient, her song, is having an allergic reaction. It turns out the student nurse mixed up his pain medication. An honest mistake, but one that could have been fatal. The doctor tells Gloria, "We all make mistakes." The tension culminates in the room of Frau Belgin. Her son runs out in a panic. "I think my mother isn't breathing anymore." Gloria rushes in. The woman is gone. Her sons beg the staff to do something, to perform a miracle. A full resuscitation effort begins. It's a chaotic, desperate dance of chest compressions and defibrillators. But it's too late. The doctor has to deliver the devastating news. She's gone. The son's grief turns to rage. They accuse the staff of neglect, screaming that no one ever came to check on their mother. The tragic irony is, Gloria was on her way. Frau Belgin was the next person on her list. She hadn't even made it to her room yet. A life lost in the margins of a busy shift. Shattered, Gloria retreats to a quiet corner, the weight of the night crushing her. But there's no time to grieve. She has to bring a cup of tea to the private patient, Severin. He's been timing her. "A new record," he sneers. 1 hour, 3 minutes for a cup of tea. And in that moment, something inside Gloria snaps. She grabs his expensive watch, the symbol of his detached privilege, and hurls it out the window. "And you," she spits, her voice trembling with fury, "are a top-class asshole, even if you are dying." Her colleague finds her in the hallway, stunned. When Gloria confesses she threw a 40,000 franc watch out the window, the colleague bursts into laughter. It's a moment of insane, hysterical relief in the middle of a nightmare. Later, covered in dirt from searching for the watch in the bushes below, Gloria faces Severin. She apologizes, promising to pay him back, even if it takes years. But Severin's demeanor has changed. "Screw the watch," he says. He confesses his diagnosis, pancreatic cancer, one of the deadliest. He hasn't even told his wife. In this quiet moment, the patient and the nurse are just 2 terrified people, connecting in their shared pain. He tells her if she finds the watch, she can keep it. The shift finally winds down. Gloria's colleague helps her finish her rounds. Gloria finds a moment to apologize to Amelie, acknowledging the hectic day. As she prepares to leave, another patient hands her something. It's the glasses, the ones the daughter called about hours ago. Gloria is exhausted, a warrior returning from a brutal war. She changes out of her scrubs, leaving the armor behind, and boards the bus home. The city lights are still a blur, but this time they feel different, heavier. The silence is no longer peaceful. It's filled with the ghosts of the night shift.